make a video about, I'm going to talk about measles, the measles outbreak. Information of April 2019. So I'm just going to wait to see if I can get some people to join. The thing I'm going to talk about today is the measles outbreak information, the measles outbreak of April of 2019. That's what I'm going to be reviewing today. I figured it was a good time because Dominic Cardy has made some type of press release recently indicating that students and teachers were going to be required to be vaccinated, or were going to be offered vaccinations. At least that's where it started. And I was kind of thinking that it sort of felt an awful lot like it felt in April of 2019 when, you know, all the stuff started happening around the measles outbreak. So basically, I am going to just review that information. And I thought it was really a really important time to know it. So basically, I don't have all of the information that I would like to have, but it appears that I probably will never ever have all the information anyway. So I'm just going to kind of start from the beginning of where I think the beginning is. And I think the beginning for me, unless somebody says it's otherwise, would be in January of 2019 when the government of New Brunswick had a press release saying that they were going to implement an electronic health record system in New Brunswick. So basically, it just says that through implementation of the public health information solution, the Department of Health will be able to better manage the process of distributing vaccines and immunizations in New Brunswick, said Dr. Jennifer Russell. So that happened in January of 2019. So we didn't actually hear anything about the measles first. What we heard about is an article in CBC News. Dominic Cardy's right there. I'll just read you the headline. Dominic Cardy seeks accurate picture of student vaccination numbers. Cardy said concerns have been raised in the media in recent days about an inconsistent application of the government's regulation on vaccination in schools. So basically what had happened here, the reason why this article came to be, apparently there was a little bit of an outbreak of whooping cough in Fredericton, and this Troy Lifford guy, he's actually used to be a politician as far as I can tell, and he was concerned because there was an outbreak of whooping cough in his son's school. And so he said, all you got to do is get vaccinated. So why isn't this happening? And Dominic, you better do something via Twitter. So Dominic puts this out here, and they even quote the Twitter that Dominic says, "We are on it. It makes no sense to say kids can't come to school with peanuts, but they can come with potentially deadly diseases. If we're going to be evidence-based, we have to live that idea. Vaccines are safe and vaccines work. Vaccinate your kids." And that was April 9th of 2019. So there's Dominic. And then what happened after that? That was, like I said, April 9th. That article came out on the 10th. And then all of a sudden on April 26th, we have a confirmed case of the measles in St. John. Oh my goodness. Oh my goodness gracious. Oh yes, one thing I wanted to mention in this article, even prior to the outbreak, a part that I highlighted in yellow right there, it says the Department of Health says 87% of children entering kindergarten have their measles, mumps, rubella vaccine. And when I was getting this together last night, I realized that I wonder why they would choose to put measles, mumps, rubella vaccine in an article which wasn't even related to anything about measles. It was just about, oh, what are the numbers of, vaccinated versus ones who have exemptions in school. And they decided to mention that 87% of children entering kindergarten have had their measles, mumps, and rubella vaccine. Seems kind of odd. So anyway, it's April 26th, first case. Infected individual recently traveled internationally, says Chief Medical Officer of Health. Most people are protected with 2 doses of measles, mumps, rubella, and varicella, or the MMR vaccine. Anyone who believes they have symptoms consistent with the measles should isolate themselves and seek medical attention. And they're describing the symptoms. Within 3 to 7 days, a red blotchy rash will appear, first on the face, then spreading to the rest of the body. So that was April 26th. And on April 26th, Jennifer Russell sends out a little memo to all healthcare practitioners. The purpose of this memo is twofold: to inform you of a confirmed travel-related case of measles in the province and to increase awareness and encourage vigilance for possible future measles infections in New Brunswick. So they're just letting everybody know that there has been a case of measles and they're on the watch out. They're reminding you what your responsibilities are. Clinical: is important that cases be diagnosed early and appropriately managed. Confirm the diagnosis by laboratory testing. Individuals that have been previously immunized may not present with the typical rash. Now it says what type of laboratory testing should be done. Collect a serum specimen for measles, which is an IgM or IgG serology. Many acute measles cases do not develop IgM until 3 days after rash onset. So the ideal window for specimen collection is 3 to 7 days after the onset of the rash. If the specimen is collected prior to this, any negative test result will require a second serum collected more than 3 days post-rash onset for detecting IgM. Also collect a nasopharyngeal specimen if within 4 days of onset of the rash, or a urine specimen if within 7 days of rash onset for PCR viral detection. So again, this is a memo sent by Jennifer Russell explaining to all healthcare practitioners what their responsibilities are in regards to measles and how they should handle it. So basically, she has said in there that you have to confirm the diagnosis with laboratory testing. So why would one present themselves at the doctor and thinking they had measles, or why would they go to the doctor? Because they would have a rash, right? They would be displaying symptoms, and they would definitely have a rash, which is what I'm going to prove next. You see in this New Brunswick Disease Watch Bulletin, it talks about measles. It's a highly contagious, transmitted by airborne droplets or through contact with the nasal or throat secretions of infected persons. People are usually considered infectious from 4 days before until 4 days after the onset of rash. Average incubation is 14 days. Natural infection, like if you actually get measles, natural infection produces lifelong immunity. Asymptomatic IgM positive persons have not been found to be infectious. So they're talking about measles right there, and it says asymptomatic IgM positive persons have not been found to be infectious. So if you're not having symptoms, you're not infectious if you have the measles. Okay. Laboratory confirmation. Measles is now a rare disease, so clinical evidence is not sufficient to confirm a case. To minimize false positive laboratory results, laboratory tests should be restricted to patients most likely to have measles, i.e., those with fever and a generalized maculopapular rash. So they're saying that a PCR test alone would not be enough to say that somebody has infectious measles. You gotta have a rash too, okay? So let's see. Moving on. Another news article. May the 1st, doctor highlights unbelievable inconvenience of measles. A little bit more hype in there, like, oh my goodness, the measles is coming and what are we going to do? And it's so inconvenient. If you would just get your damn vaccines, everything would be fine, right? Highlights from this article. LeBlanc, who worked an overnight shift Friday, said she was woken up after her shift and had to go do a number of blood tests before she could come back to work. Had I not been immune, all the patients I had seen on Friday night would have had to be contacted and would be potentially getting measles, she said. For patients who have a normal immunity and have been vaccinated, that's not a problem. But for anybody on chemo or has anaphylactic allergy to eggs that can't be vaccinated or has any kind of immunosuppressive situation, they would be at high risk from me were I not immune. And then she goes on to state that we still have one doctor who tested negative for measles immunity, despite the fact that he has been vaccinated and had all of his vaccinations, and so he can't go to work for 2 weeks on account of this person. I mean, the poor doctor, he lost 2 weeks of work because there was a suspected measles case. My goodness, I'm sure it's broke the bank. Many people are unaware that their immunity can wear off over time. People born in Canada between 1970 and 1996 may need an extra dose of the vaccine to protect them. Even though we're told time and time again that 2 doses is entirely enough. So, more hype. Case of measles in St. John prompts flurry of calls. And the fear factors getting ramped up, but the advisory about the infected person who recently traveled to Europe has prompted a flood of calls, according to Bruce McFarlane, a spokesperson for the Department of Health. Telecare, the province's free confidential health advice and information line, has fielded at least 66 measles-related calls. Ooh, I'm sure it's very, very bad. Okay, moving on. May 13th, second case of measles confirmed in New Brunswick. Second case. Public Health is investigating a second confirmed case of measles, the province announced Monday. The case was confirmed at Kennebecase's Valley High School in Quispamsis. This news comes less than a month after the department declared the first confirmed case of measles in New Brunswick. On April 26, Public Health said a person in St. John who recently traveled to Europe was infected, and department officials were working to contact people who may have been exposed. Okay, so that's 2 cases. So what I had been doing is making information requests to the government to find out about this measles outbreak, because I didn't know what was going on. Like, I didn't even know how they detect measles. I didn't know what they were doing, how they figured out that these people were actually infected. And I also wanted to know what kind of vaccination cards they had. So I made some requests to the government. And what I received was kind of weird. But they didn't want to give me the results. They actually, when I made a request, I said I'm requesting copies of any records, reports, documents which would indicate, list, or confirm the vaccination status as it pertains to the measles, specifically the MMR vaccine status or any variation thereof, as well as the number of doses of that vaccine that had been administered prior to the outbreak to each of the 12 individuals who were confirmed positively infected with the measles during the Cases Valley outbreak in April and May of 2019. And number 2, I'm requesting copies of any documents, results, reports, records, memos, which indicate, list, or specify the strain, variant, type of measles detected and confirmed by the laboratory testing for each of those 12 confirmed cases. So when I made this request, Ted Fleming was the health minister, and he gave me a PowerPoint presentation with headlines, but he blanked out all the data. So yeah, Ted Fleming was unwilling to give me any information. So what I did is I contacted the ombud, because that really didn't make me very happy. And then I got delayed a little while because the ombuds said that because of COVID, things got pushed back, and all of their timing that they had to do things in didn't matter anymore, because they were going blanket until the fall and nothing was going to happen over the summer. So I had to wait a really long time for any action. But basically, then the election happened, and what's her name is now the new health minister, Dorothy Shepherd. So the request was made to Dorothy Shepherd to see if she would provide information, and Dorothy Shepherd actually decided that she was going to uncover one column of the report. So on this one it says immunization history of cases, ages and cases of the first and second doses of MMR, and by whom the vaccines were administered. So all they told me was the amount of doses for the 12 people. And actually it's pretty telling here, because what it shows is that one person had 0 vaccines, 2 people had 1 dose, and the 9 remaining people had the full 2 doses of MMR. Which, I mean, right there, that's somewhere about 95%, if they were going off some fictitious herd immunity theory there. You could easily see that, 95% of these people were vaccinated. And so I don't really know how these people got measles. I mean, 9 out of 12 people had both of the doses. So what's the problem? I'm not really sure. Anyways, the second page, it says again the vaccine doses, which isn't of any use because I just showed you the first page. And finally, the third page, which is really funny, it shows that all of the cases, laboratory results, all said wild type. You see that? Wild type variant. So I'm thinking, well, I could have made this PowerPoint presentation in 5 minutes and just pop that data in there. And so where's the proof that this was actually the case? So I sent another email and asked for proof, and there was a little bit of time that went by, and then I told them I wanted the lab report, so I actually received the lab reports. I received 12 lab reports, and all I wanted was a unique number and a date on it. That's all I felt was necessary. So the really interesting thing, which I've already revealed to most people, is that first off, they're using PCR tests to determine whether you are infected with measles or not. But the difference, notably, the difference between measles diagnosis and COVID diagnosis is when you have measles, you actually have to have a medical professional see you and see that you have, like a rash or symptoms consistent with measles, and then they do twofold testing to confirm a measles diagnosis. Whereas COVID, they just do PCR testing and say, oh yeah, you're sick. So anyway, this is the very first measles lab result. This is supposed to be the lab result of the person who was the travel-related case. Okay? So what's noteworthy about this is that the specimen was collected on April 25th, which is consistent with the news articles of the time. And also what else is notable here is that it says measles PCR positive. Sample will be submitted to NML for genotyping. Reference lab, George Dumont. So the George Dumont was sending a sample to the NML for genotyping. And if you know what genotyping is, it would be the information that would enable you to know where the measles came from. For example, if it's a wild type of measles, it looks a certain way and it has a certain number. And you may not know this, but the measles vaccination can also give you a measles-like illness. So it has been recorded in previous cases that the genotyping information is actually that of the vaccine strain, just so you know. But here, this is patient 0. And patient 0 does not have any genotyping results. So from what it looks like on paper, this could be vaccine strain or it could be wild type measles because they don't say. Now, I just want to compare that with the second record from the second case of measles. And you'll notice here that this has a later date. And it also says that the genotyping is D8, which happens to be a wild type measles. So they did genotyping for the second case, but they didn't do any genotyping for the first case. I guess knowing where the patient 0 measles came from wasn't an important factor. Another thing to note here is you'll notice that this says it's verified on 04/26, which is the exact day that the testing was started. You see it says started April 26th. And then you'll see like this one says that it was started on May 12th, but it was verified in June. And another thing to note is the date that was printed down here, June 12th. And this record, which is incomplete, was printed on April 29th. It was printed on April 29th in an effort to negate the results of the genotyping. So I was given a record that was printed too early to show the genotyping results, FYI. Okay? And all they did was send me copies of something they printed early. So I don't know if they think I'm dumb or something. Maybe they do. Maybe I am dumb. I'm not sure. So anyway, I have genotyping results from 4 out of the 12 lab reports. And it's probably good to note that I got PCR tests that were done with urine. That was done. The first one was done with urine, by the way. They can do PCR tests with the urine as well. They don't have to stick a swab up your nose, by the way. Second one is a swab. Third one is urine. Fourth, urine. Fifth, urine. Sixth, urine. Seventh is a throat swab. Eighth is urine. Ninth is urine. And 10, 11, and 12. 10 and 12 are immunology reports. So basically, they're looking at the status of the person's immunity to measles. They're not even testing for viral material. They're testing for immunity. So I don't know if that alone says that a person's infected, because, I mean, if I've had regular measles, I'm immune to measles. So this should come out positive. That doesn't equal current infection. So I don't know. Then we have another PCR test, and that was a nasal swab as well. And finally, we have one more immunology report saying that this patient is positive for measles IgG and measles IgM. And, you know, they can't genotype that type of test, FYI. So anyways, I would summarize that these lab reports have been cherry-picked to death to, like, display only the basic information. I would definitely say that if they printed out, if they went to the system, that they queried this lab report system and gave me a report with a date on it that was recent, I would think that patient zero's genotyping information would show up. So I'm going to request that. And I think that it would reveal that the genotyping information might be something other than what we're told. And so, you know, I'm not just assuming that, but I don't know why they would go to such trouble to, you know, keep me in the dark. So I sent them an email on February 28th. Thank you. I have 2 further questions. I have compared the data in PowerPoint presentation to the data I received in the lab reports. There are only 4 lab reports that show the genotyping information. The 8 remaining reports don't show this information, and it was disclosed to me in the email from the Department of Health that not all genotyping info is available. Am I to assume, I'll just remind you of that because there was only 4 reports with genotyping information, yet they said that they had the genotyping information for all 12 patients, okay? So am I to assume there is missing evidence, which was used to create the PowerPoint presentation, which I could have done myself? It was noted in the presentation that all 12 measles cases were of the wild type. I have not been able to confirm this via the lab reports I recently received, so I am requesting any information, other miscellaneous lab reports that could support the claims made in this presentation. Additionally, I was wondering if the minister could direct me to the appropriate government, blah, blah, blah. Okay. So then the Ombud asked the Department of Health why that was, and this is the answer I got. It's right here in black and white. I can provide it to you if you're interested, but here's what they said. Good morning, Miss Kramer. I followed up with the Department of Health about your remaining concerns to ask why only certain lab reports showed the genotyping information and whether this was the same type as the wild type indicated in the previous records disclosed to you, and if so, where the department got the wild type information if it did not show up in the lab reports. The department responded with the following explanations, which were given by a doctor from public health. And I quote, "They were all verbal from the National Microbiology Lab. The only reason why we do this sequencing is to make sure that it's not a vaccine strain. Once we have identified D8 and have linked all of the cases together, the only requirement is to ensure that it is not a vaccine strain." So, I mean, it's really funny because D8 is not the only genotyping sequence there is, but she chose to say that, oh, we're looking for D8, and once, you know, we find D8, then it's all good. We can link them all together. But she forgot to mention that she didn't genotype, or she didn't have the genotyping results for the patient 0. So she never actually was able to confirm that the measles case came from Europe because there is no genotyping data for that patient 0. So I will make an inquiry to Ombud one more time, telling him that I want those pages queried in the database now and printed as of now, not as of April 19th of 2019. So we'll see where we get. So I had a lot more news articles at the time, but I didn't want to bore you because I realized I was getting kind of long-winded. But there was a lot of propaganda in that time frame, and the propaganda that was being spewed at us is very similar to the propaganda that's being spewed at us now. The language is similar. The tactics are similar. Instilling fear, repeating the same concepts over and over, and then, just making people line up for their vaccine because they're afraid, even though most people already had the 2 doses that they required. And so, like, there was a vaccine campaign to vaccinate. They vaccinated over 15,000 individuals as a result of this. So I'm just going to read you some highlights from these articles. The second confirmed case related to the first, the province's chief medical officer of health confirmed on Tuesday. The affected individual at Kennebecase's Valley High School, who was identified Monday, is now isolated at home. At the same time as the first patient in April. Okay, what's some more highlighted points? Oh, here's what Jennifer Russell said. It's too late to protect them from this particular event, but would protect them from possible future exposures to the virus, which is transmitted through the air or by direct contact, which is really noteworthy because she said that on May 14th. But then she says there's an immunization clinic being planned for the school. So if it's already too late to protect them, why do they need a vaccination clinic, immunization clinic? I don't know. It doesn't make any sense. There's no consistency. Just like now, it's like no different. It almost feels like this was it was a test case to see how we would react and what we would do, really, with a virus, how we would comply. So we went through this whole measles outbreak, which hasn't even been proved to actually be what it is they said that it was, even after it's been 14 months since I originally requested the documents, and I still don't have the proof that I need to put my curiosity to rest. Like, if they gave me paperwork which showed that I was wrong and that the measles, the fact that it was obtained from Europe travel, if I had the data and it made sense, I would leave this alone. I would probably be making a video saying, well, you know what, I made a lot of hype over nothing, it's not true, and they've given me all the proof that I needed and they proved it, but they haven't done that. And if it isn't evident by what I've said in this video, then I can give you the paperwork, I can show you the proof. It's not a problem. Public health officials are working on transferring immunization records to an electronic database. So information about vaccination rates is readily available, but it's quite a large project and expected to take about 18 months to complete, she said. Yeah, and then we have doctors' opinions about some people got lackadaisical about it, so now we're bringing it to the forefront of their minds. Yes, we are. One vaccine offers about 85% protection, and 2 doses are almost 100% effective. But I will remind you, again, of the amount of vaccinations here in this paper. 2 doses, says Dr. Mike Simon. 2 doses are almost 100% effective. Look at this. We have 9 people who had 2 doses, and they still got measles. Would you call that 100% effective? I wouldn't. So crazy. Anyway, I go on. So he goes on to say, Dr. Mike Simon, so people can get in there, get fixed up, and we can hopefully down the road erase the worry from their mind. And people can get into the regular habit now of, I'm not going to question the vaccine. That's very important. We're going to get it. We're going to protect the public, protect the kids especially. This is the same mindset that we're seeing now. Moving on. More hype. 460 teachers potentially exposed to measles at Canada Case's Valley High School. They're really ramping up the panic now. Boys, we better get them going in there. About 100 of the approximately 1,050 students do not have the 2 recommended doses of measles. That's really important because they say in here about 100 of the approximately 1,000 students do not have the 2 recommended doses. Yet I know that over 15,000 people got vaccinated. So if there was only 100 who didn't have both doses, why the 15,000? I mean, even if we talk about teachers, for how many teachers would be there for 1,000 students? I don't know, 50? 100? Maybe? So that's 200 people. 200, 15,000. Where did the 14,800 people come from that were vaccinated? I don't know. And they keep repeating in there that the Department of Education's policy 706 does allow for exemptions from immunization for either medical reasons or personal objections, but only a very small number go that route, said Watson. In the event of a significant outbreak, those students would be excluded from school, said Watson. So on May 15th, we get a little bit more hype. Mother says hospital ERs unprepared for measles patients. She took her son in there. It turns out that her son didn't have measles. He had fifth disease, but she said there was very little isolation and they didn't seem to care what was going on there. They weren't concerned of him spreading his disease around. So they're just, introducing that fear too, because now you have to fear potential infection, right? Because they're just getting us prepared and amped up for vaccination, or maybe they were getting us prepared for COVID. Who knows, right? Unless urgent care is required, they should remain at home until 4 days after the rash appears, said Shannon McLeod, Senior Communications Advisor. People who think they have measles should also call Telecare 811. Oh, more hype. People need educating about life-saving measles vaccine, ex-specialist says. More hype plus plus. Oh, they need to talk about the vaccine now. There is this balance of individual rights and community rights, said Joanne Langley, who is also chair in pediatric vaccinology at Dalhousie University. I wonder if Joanne Langley really gives a crap about people's rights, considering that she's the pediatric vaccinology chair at Dalhousie University. We have an individual responsibility to take care of the people that are around us, whether it's our family or general community. Yes, it's my job to take care of everybody else, not just my family, but I got to take care of everyone, right? Yeah. And she goes on to say, the province recommends children be immunized at 12 months and again at 6 months. That's all the vaccine you really need for life. So again, I'll just point it another time to my lab results. The ones with the blanked out thing here. 9 out of 12 people had their full 2 doses and they still got measles. So you tell me, is that vaccination really effective? Does that not tell you what you need to know? So questions that I can conclude out of that. So these tests for the measles wouldn't amount to anything unless a doctor ordered them and that doctor saw that the person was actually symptomatic, like they had the rash or the white dots in the mouth. Because you can't just diagnose somebody alone for viral infection unless they actually have symptoms. And this is relevant because it relates to this whole COVID nonsense, and whether you think this is a new disease or not, like it's there's nothing new under the sun. If they say it's a virus, and it actually, if you're sick, you will have symptoms, and if you have symptoms, then they can go on to proceed to test you and say, okay, yes, this person has COVID, but they just can't arbitrarily make you take a test and say that you're sick. If you don't have any symptoms, you're not sick. And so you shouldn't be held to the same type of, things that you need to do, practices when you don't have symptoms. You don't have to isolate when you don't have symptoms. You need to isolate when you have symptoms. That's how you know you're sick. So again, I'm going to ask for recent printed copies of those test results because they scammed me by having the first one printed off a couple of days after the test was done. And so they scammed me out of the genotyping information because I believe that the record would have been updated with the genotyping information had the record been printed a little bit later. But I was scammed, and I will call them out for that. And so lastly, I'm going to say that the other way that we can bring light to this situation is if those people who actually claim to be or, were tested to be infected or told that they were infected with measles, there would apparently have been one, I think it was an adult person who became infected, and they said from travel in Europe, if that person would come forward, or any of the other people or their parents, because what I can conclude is that at least 10 of the 12 individuals were children or, young adults in high school. So if any of you young adults in high school who were claimed to have had measles in the April and May 2019 outbreak, if you can contact me, that would be so good, because I'd like to know, did you have any symptoms? Did you have a rash? Because that's really, really, we got to know that. Like, we really have to know that. So, I'm just going to show you my email address and my contact phone number. If you know anybody who had measles in the outbreak of 2019 in the spring, if you know anybody who was threatened to not be able to graduate if they didn't get an additional dose of the vaccination, even though they were all dosed up with their 2 required doses, I do have one of my last articles here. It actually says that the government threatened, or the school threatened, listen to this, on Friday, and this date was May 29th, which is like the end of the outbreak. On Friday, public health officials issued a directive that staff and students at the high school must receive a measles booster shot if they want to continue working and studying at the school. Now, you tell me if that makes sense here. They knew the vaccination status of these 12 people. They knew 9 of those people had their 2 full doses. Why would public health issue a directive that staff and students at the high school must receive a measles booster shot if they want to continue working and studying at the school? Coercion? Do you anticipate this level of coercion, repeating itself? We knew? You knew? What? Fake. Unless I receive an updated version of the lab reports that are printed with a date in 2020 or 2021 that show me all 12 measles PCR tests and the genotyping information, this measles outbreak was a scam, and you can take that to the bank. If you want any of the information that I have sort of shown you here, let me know. I'll provide it. And I just wanted to say that I had a great time in Fredericton yesterday with all that beautiful sunshine and beautiful smiles of people and great attitudes, and the energy was amazing. And today I had a really good time uptown too with the people in St. John, and all I can say is people are getting really tired of the bullshit, and I just showed you all the evidence that they've given to me to try to make me convinced that the measles outbreak was legit, and I'm telling you that they have not provided information that would legitimize that outbreak. I'm pretty thorough, and if the evidence existed and I was wrong, I would admit it, but it doesn't exist. Mwah! Love you. Have a great rest of your Sunday.